sometimes is more important than actually examining it. Because hand-holding is important too. And we can hope for different things. We can hope for a cure. We can hope for a better life. We can hope for comfort. But there's always something to hope for. This is a CAT scan of another hero we're going to present tonight. It's a cross-section of the abdomen. These are the kidneys here and the spine. And this structure here is the pancreas. And there's something right in the middle of the pancreas here, a round ball. And this darker area is the pancreatic duct, which is the tube or the plumbing that connects the pancreas to the intestine so it can secrete all its juices. And this mass, as it's called, is blocking that tube so it's dilating it. This is a very ominous sign for pancreatic cancer. This CAT scan was done on a patient who was getting a scan for another reason. And after this was seen, all the doctors were concerned. And I do a procedure where through the stomach, I can access the pancreas with a needle and take a biopsy. We have technology today that's unbelievable. To be able to do an outpatient procedure in which I could put a needle through the stomach into the pancreas, have the patient wake up and not even know it happened, and go home within an hour is unbelievable. We have unbelievable technology. We live in a time where we understand DNA and we're beginning to learn how cancers develop. We live in a time of great and unexpected research and results. There's probably no better time that I could think of to be a physician. And a procedure like this where we can easily get a diagnosis is part of that. But the diagnosis is only the first step. The next step is what are we going to do about it? Well, first we have to meet the patient because we're not going to treat a CAT scan. I didn't tell you how old this patient is. 84. And guess what? This patient is a woman who is active. She lives alone. She's been involved in the Democratic Party and I understand quite vocal. And this is not a woman who is ready to die. Her age was almost irrelevant. And I felt that even more when I met her. She came with her family. And when I met her and her family, and she really had no major health issues, and she walked in and she told me about herself, I knew this woman wanted to live. And I looked at the CAT scan, and yes, this tumor's there, but you know what? It looks confined. And theoretically, surgery can only resect it. This might be one of the rare forms of cancer that if we get to it early enough, we could cure it. But often people hear pancreatic cancer, they hear 84, and they say, come on, you got a terminal disease, you have an 84-year-old woman, enough is enough. I can't stand when I hear in these healthcare debates when they start talking about age as a cutoff and restricting care to older patients. You know, our older patients are so much a part of our lives, and they're someone's mother or grandmother. More importantly, they've lived more experiences than any of us. Older people actually have a lot to tell us and teach us. Why we write them off because of an age, I don't know. But this woman wasn't going to be written off. Not only was she someone who was living and living her life, but after explaining to her and her family that I think that we could potentially do something about this, she was ready to undergo surgery and undergo treatment. What did it mean? It meant surgery, it meant chemotherapy, it meant radiation therapy. And before I was going to make this decision myself, I brought it to the group. I told you that we have a whole group at the Monahan Center, and we sat down, including the social worker, and we said, is it appropriate to operate on this woman? And universally, after we went through everything, everybody said, you know what, she has a chance of survival, and there's no reason that she can't live. Why are we going to write her off? Why are we going to say that there's no hope for this woman? So the surgeon met with her and operated on her, and she did phenomenally well. Flew through the surgery, got the chemo, got the radiation, and I said she was 84 at the time. This is a picture of Irene Dworeck with me. We are dancing at her grandson's wedding. This is almost 5 years after the diagnosis that I showed you, after that CAT scan. I've become very friendly with their family. And one of the things, really privileges of being a physician, is that sometimes you can really live the successes with your patients. And when they invite you to a wedding, you go to the wedding and you dance with your patient. And here I am dancing with Irene Dworeck, the two of us at her grandson's wedding, 5 years almost after her diagnosis of pancreatic cancer. And this woman is so phenomenal that I have a special treat for you. She is here with us today. Irene's going to come up. Irene. I will tell you. Okay. Cool. I'm going to tell you that this is a woman who is not only a hero to me, but everyone who knows her looks up to her. And I said that was about 5 years, that picture. Well, guess what? This weekend we are celebrating. Want to tell everybody, or you want me to tell them?
I hate to tell my age, but it's out now, and I'm going to. I was 90.
Oh.
I guess I have to excuse myself. When I walked up the stairs, as you saw, I was very wobbly. Has nothing to do with the cancer. Unfortunately, I have macular degeneration, which makes me legally blind. The cancer at this point in time has taken second place. I only think of my eyes and hope that my eyesight remains stable. But if it's okay with Mark, I'd just like to wish and hope that everyone in this audience never, ever has to hear a diagnosis and that horrible word of cancer and that horrible diagnosis and what you're thinking and what you have to go through. There is nothing like. Everybody has a different way of taking a diagnosis. Some laugh, some get hysterical, some faint. I am basically a strong person. I went through World War II. I saw lots of things I shouldn't have gone through. I've gone through lots of chapters bad in my life. But this, somehow, it does get to you, however strong you are. The only thing that I feel, there has to be hope. Without hope, might as well go to bed, throw the covers over the head. And I always remember telling Mark, I'd spoken to a group of students before, and he said that my attitude helped me get through this. And I said, I always remember, and I think some of you are old enough, I see quite a lot of young people, that are old enough to remember Gone with the Wind, where Scarlet O'Harvestead. I won't think about it today, I'll think about it tomorrow. As far as I'm concerned, tomorrow never comes. I don't think about it. I go on with my work. And as I say, I was so fortunate to have a doctor that cares, a team that cares, and that's what you need. You need hearing. I am perturbed at this point in time when I hear, and I only hope it's a rumor, that when we get to 70 years old, we're not going to get treatment. I hope this is all a rumor. What kind of society would we become? You all have parents. Your parents look forward to their golden years. They saved for it. Don't let the people, whoever they may be, get their golden years tarnished. Take care of your parents and fight for their right to live. They are not God. I hope everyone has a good, healthy, and prosperous life.
Just want to end by saying, again, you see what a privilege it is to be a physician, to be able to meet people who are so incredibly passionate about living. It re-energizes what we do, and it makes us want to do more.